Depression is a significant and often misunderstood health issue that affects a vast number of people across the globe. It is in fact the leading cause of disability worldwide, touching the lives of nearly 1 in 10 adults. For seniors, the transition into later life, with its unique challenges such as retirement, loss of loved ones, or changing health, can sometimes create an environment where depression can take hold. It is crucial to understand that this condition is not a normal part of aging, but a serious medical illness that requires attention and care. Recognizing its prevalence is the first step towards dismantling the stigma that so often surrounds it, allowing for open conversations and proactive support within our communities. It is vitally important to distinguish between the natural emotion of sadness and the medical condition known as clinical depression. We all experience moments of feeling down or blue. These feelings are a normal reaction to life's inevitable disappointments, such as receiving a poor health report or simply enduring a spell of dreary weather. These emotional states are typically temporary and tend to lift as circumstances improve or time passes. However, clinical depression is something far more persistent and pervasive. It is a mood disorder that settles in for at least 2 consecutive weeks, casting a heavy shadow over every aspect of daily life and refusing to dissipate on its own. This distinction is fundamental to understanding when help is needed. To receive a diagnosis of clinical depression, a person must experience at least 5 specific symptoms that significantly impair their ability to function. The most prominent of these are a persistently low mood and a profound loss of interest or pleasure in activities that were once enjoyed, a state known as anhedonia. Other key indicators include noticeable changes in appetite, leading to either weight loss or gain, and significant disruptions to sleep patterns, such as sleeping far too much or struggling with insomnia. These symptoms are not fleeting. They are a constant presence that drains the color from life, making each day feel like a considerable struggle to get through. Further symptoms that contribute to a diagnosis of depression include overwhelming feelings of worthlessness or excessive, unfounded guilt, which can spiral and distort one's self-perception. Many individuals also report a crippling loss of energy and persistent fatigue that is not alleviated by rest. Cognitive functions are often affected, leading to poor concentration and difficulty in making decisions. In some cases, there might be a noticeable physical restlessness or, conversely, a marked slowing down of movements and speech. Most seriously, depression can bring recurrent thoughts of suicide, making it an urgent and life-threatening condition that demands immediate medical intervention and compassionate support. Depression is not merely a state of mind, it is a complex illness associated with tangible physical changes within the brain. Advanced imaging studies have revealed that individuals living with depression can exhibit structural differences in their brains, such as smaller frontal lobes and reduced hippocampal volumes. The hippocampus, in particular, is a region critical for learning and memory, and its shrinkage can contribute to the cognitive difficulties experienced during a depressive episode. These physical alterations underscore the biological basis of the condition, demonstrating that it is a disorder of the brain just as much as any other neurological condition, and not simply a matter of negative thinking that one can easily overcome. The chemistry of the brain is also profoundly affected by depression. The condition is linked to the abnormal transmission or depletion of key neurotransmitters, which are the chemical messengers that allow brain cells to communicate. Serotonin, norepinephrine, and dopamine are 3 such messengers that play a vital role in regulating mood, pleasure, and motivation. When their levels are imbalanced, the brain's ability to manage emotions is severely compromised. This chemical dysregulation helps to explain why depression can feel so all-encompassing and difficult to control through willpower alone. It is a genuine malfunction in the intricate communication network of the brain, requiring targeted intervention to restore its delicate balance. The influence of depression extends beyond brain chemistry to disrupt the body's fundamental biological rhythms. One of the most common effects is the disturbance of our circadian rhythm, the internal 24-hour clock that governs our sleep-wake cycle. People with depression often experience significant changes in their sleep patterns, including alterations in the stages of sleep like REM and slow-wave sleep. Furthermore, the body's stress response system can go into overdrive, leading to hormonal abnormalities. Chronically high levels of the stress hormone cortisol are frequently observed, as is the deregulation of thyroid hormones, which can further exacerbate symptoms of fatigue and low mood, creating a vicious cycle. While the precise cause of depression remains a subject of ongoing scientific investigation, it is widely understood to result from a complex interplay between genetic predispositions and environmental factors. A person may inherit a genetic vulnerability to the condition, but this does not mean depression is inevitable. Often, it is a significant life stressor, such as bereavement, chronic illness, social isolation, or a major life change, that acts as a trigger. Because there is no single cause, there is currently no simple diagnostic tool that can predict who will develop depression. This complexity highlights the need for a holistic and individualized approach to understanding and treating this challenging illness. One of the most concerning aspects of mental illness is the significant delay in seeking help. On average, a person experiencing a mental health condition like depression waits over 10 years before reaching out for professional support. This delay can be attributed to a variety of factors, including a lack of awareness about the symptoms, fear of judgment or stigma from family and friends, or a belief that the feelings will eventually pass on their own. For seniors, there can be an additional generational reluctance to discuss emotional struggles, viewing it as a sign of weakness. It is imperative that we work to break down these barriers and foster a culture where seeking help for mental health is seen as a sign of strength and self-awareness. Fortunately, once an individual does seek help, there are highly effective treatments available that can significantly alleviate the symptoms of depression and restore a sense of well-being. The most common and well-established approach involves a combination of medication and psychotherapy. Antidepressant medications work by helping to rebalance the brain's neurotransmitters, such as serotonin, thereby correcting the chemical imbalances that contribute to the low mood and lack of energy. When used alongside psychotherapy or talking therapy, which helps individuals develop coping strategies and change negative thought patterns, the results can be truly transformative, offering a comprehensive path to recovery. For cases of severe or treatment-resistant depression where standard therapies have not been effective, there are other powerful medical interventions available. One such treatment is electroconvulsive therapy, or ECT. Although it has been portrayed dramatically in popular culture, modern ECT is a safe and highly effective procedure performed under general anesthesia. It involves inducing a brief controlled seizure in the brain, which can rapidly reverse the most severe symptoms of depression. While it is typically reserved for extreme cases, ECT can be a life-saving intervention for those who have not found relief through other means, offering hope when it is needed most. The field of psychiatry is continually evolving, and new and innovative treatments for depression are emerging, offering hope for even more effective and targeted therapies in the future. One of the most promising of these is transcranial magnetic stimulation, or TMS. This non-invasive procedure uses magnetic fields to stimulate nerve cells in the brain region involved in mood control. TMS is an exciting development because it offers a treatment option with fewer side effects than some medications and does not require anesthesia. As research continues, such advancements are paving the way for more personalized and effective care, ensuring that more people can find a successful route out of the darkness of depression. If you suspect that a friend, family member, or partner is struggling with depression, your support can be an invaluable lifeline. The most important first step is to gently encourage them to seek professional help. You can offer practical assistance, such as researching local therapists or general practitioners, helping to prepare a list of questions for their first appointment, or even offering to accompany them. Your role is not to diagnose or treat them, but to be a compassionate ally who helps them access the medical care they need. Approaching this conversation with empathy and patience can make all the difference in their willingness to take that crucial step. When talking to someone with depression, the language you use matters immensely. It is essential to avoid statements that minimize their experience, such as comparing it to normal feelings of sadness or suggesting they simply need to cheer up or pull themselves together. Such comments can induce feelings of guilt and shame, reinforcing the mistaken belief that they are somehow at fault for their illness. Instead, listen without judgment, validate their feelings, and offer your unwavering support. Remind them that you are there for them, no matter what, and that their illness does not change how you feel about them as a person. It is crucial to reinforce the message that depression is a legitimate medical condition, not a character flaw or a sign of personal weakness. Drawing a parallel to other chronic illnesses can be helpful. You would not tell someone with diabetes or asthma to simply get over it, and the same principle applies to depression. It is an illness of the brain and body that requires medical treatment and management. By framing it in these terms, you help to dismantle the internalized stigma the person may be feeling and empower them to view their condition as something that can be treated, rather than a failing they must endure in silence. Finally, do not be afraid to talk openly and directly about depression, and this includes discussing the topic of suicide if you have concerns. Contrary to a common myth, research shows that asking someone directly if they are having suicidal thoughts does not plant the idea in their head. In fact, it can have the opposite effect. Bringing the topic into the open can provide immense relief to the person struggling, and has been shown to reduce their risk of acting on those thoughts. It signals that you are willing to share their heaviest burden and are not afraid of their pain, creating a vital connection that can be life-saving.